I want to review some pharmacology and do some practice NCLEX questions on some of the medicines that we've been discussing. These include pain, seizure medications, Alzheimer's, Parkinson's, and anti-infectives. These will all be on your first unit HESI exam. So, the first thing I wanted to review for pain medications, make sure that you have a comprehensive knowledge of opioids and non opioids. And you need to know their mechanisms of action, what complications may arise, and what are your interventions in patient safety. So let's look at some practice questions. And so not only for a HESI exam do you need to know the content and know all these medicines and everything else you need to know for the exam, but also how to take the test. And so I'm going to walk you through how to approach these questions. And so first, you want to read the question twice and make sure that you understand what it's asking. These questions can be tricky, and sometimes you'll select the wrong answer just because you didn't understand the question. So first, always start and make sure you understand. So this one is, what opioid medication has the highest risk of respiratory depression? So we talked about how opioids, that is one of the big things, is going to make them breathe slower. And so so once you understand, okay, we're selecting the one that makes them breathe slower the most. Okay. And so all of these are correct. All these answers are correct. And NCLEX and HESI love questions like that, where all the answers are right and you have to choose the best one. And so morphine, codeine, hydrocodone, and fentanyl, they're all opioids. They all cause respiratory depression. So you just have to know and be familiar with these medicines. And so which one is the most severe? And so morphine is our standard. Codeine is very mild. Hydrocodone is higher than morphine or codeine. But fentanyl is the highest. It is the highest. It is a synthetic opioid. It is the strongest. It is the one people overdose more. And so that would be the best answer because it has the highest risk of depressing respirations. It is actually 50 to 100 times more strong or more potent than morphine. And so you have to be really careful with dosing and make sure that you are monitoring patients extremely closely while they take this. Also, it's important to know that naloxone or Narcan is the antidote. And if you think that people are breathing too slowly, then you can give them a dose of Narcan and that will help reverse the effects of the opioid. Okay, so we have a patient on NSAIDs, and NSAIDs are non-steroidal anti-inflammatories, and they're reporting stomach pain and black stools. And so we're going to look at this. What is the nurse's priority? What is the most important thing? What are we going to do? So if patient has black tarry stools, that indicates an upper GI bleed. NSAIDs are extremely harmful to the GI tract. So if we are afraid that a patient is having an upper GI bleed, our priority is to notify the doctor. That can be a potential bleeding emergency, and so we have to notify the doctor. It can be life-threatening. Okay, so for seizure medications, what lab value must be monitored regularly in a patient taking phenytoin? So when we went over phenytoin and seizure medications, I told you that it has some really bad side effects. You have to monitor and assess patients frequently. So part of that is watching their labs. And so the things we're going to look for, okay, so potassium is not affected. So when you understand the question, the next thing is look at every answer. Always look at every answer. Usually you can eliminate one of them. And so we can eliminate potassium because potassium should not be affected by taking phenytoin. So we're just going to eliminate that. So now let's look at the other answer. So 2 is a serum phenytoin level. So where is phenytoin in the blood? Okay. Is it too high, causing toxicity, or is it too low, not being effective? And then there's liver enzymes. These are important, and phenytoin can affect liver enzymes, but is it the most important? And then the last one is the blood glucose. So this isn't a concern. So we can eliminate potassium, we can eliminate blood glucose, and we're going to narrow it down to answers 2 and 3. A serum phenytoin versus a liver. So livers are very important, yes, but a serum phenytoin level. So if a patient is not in a therapeutic range, which is 10 to 20, which is a small range, it can risk seizures if it's too low, but if it's too high, it can cause the patient to have phenytoin toxicity that can cause nystagmus, ataxia, confusion, and fatal complications, which means death. So if a patient can die from having a toxic phenytoin level, is that more important than the liver dying? Yes, the liver can die from taking this, but we're going to have signs. So the most important would be the phenytoin level because it can lead to death. Okay, another question. A patient on valproic acid develops bruising and bleeding gums. What should the nurse expect? So we're going to read this question, make sure we understand. Okay, we got a patient that's on valproic acid for their seizures, and now they have bruises and bleeding gums. What do we think's happening? Okay, so A, is it an allergic reaction? So if it's an allergic reaction, we're going to expect itching, a rash, maybe the airway closing. Okay, thrombocytopenia. Well, first we need to understand, what is thrombocytopenia? We can't choose that if we don't know what the word means. So thrombocytopenia is a bleeding disorder. Okay, it's people have trouble clotting when they have this. Then we have liver failure. And patients in liver failure can have some bleeding problems. So we need to keep that in mind. Okay, infection. So an infection would be things like fever, some other systemic problems. So I feel like evaluating these, we can eliminate an allergic reaction and infection because bleeding doesn't indicate infection or allergic reaction. We said that with liver failure, we can have bleeding, but thrombocytopenia is a bleeding disorder, and it is a side effect of valproic acid. So it is the best answer. So valproic acid suppresses our platelet production of us making platelets. And so thrombocytopenia has a bleeding risk, and immediately we would want to do labs and check their bleeding and how much blood they have, and we would expect that this is thrombocytopenia. So the answer is B. Okay, let's look at our Alzheimer's, and Parkinson's is not together. Let's just look at Alzheimer's. Okay, so donepezil is given for Alzheimer's. What are the common side effects? Okay, this is an easy question. So what are the side effects of donepezil? So hypertension, which is high blood pressure, that's not usually a side effect. Bradycardia, yeah, definitely. Okay, diarrhea, yeah, definitely. Insomnia, not so much. So we're going to eliminate A and D because those are not side effects of donepezil. So do we use bradycardia or diarrhea? So bradycardia, if we do our ABCs, is definitely more important because airway, breathing, circulation, so that's involved circulation. But it says a common side effect. Common is the key word. So for common, diarrhea is the most common because it affects the acetylcholine. And it is very, very common to get diarrhea with donepezil. And so because it is more common, and the question specifically said what common side effects should the nurse watch for, we're going to choose diarrhea. Had it said what is the priority would have been bradycardia because of our ABCs. But it didn't. It's a common. Okay, so we have a patient taking memantine that is reporting dizziness and a headache. What should you do? What is the best thing to do first? Okay, so we're going to advise for them to stop taking it. Well, no, we're not a doctor. We can't tell them to stop taking a medicine, and it's not good to abruptly stop these. We're going to assess the blood pressure and fall risk. Okay, that one kind of makes sense. We're going to increase the fluid intake. Okay, so sometimes when somebody's dehydrated, they may have a little bit of dizziness and a headache, but that still doesn't address the main problem, that it's a side effect of memantine. Schedule an urgent MRI. Well, that's just too quickly. That's too quick. Like, this is a common side effect. We're not just going to do an MRI. We know that this is being caused by the medicine. And so the best thing is to assess. And so oftentimes, if it is an option to assess, that's a good option, because as nurses, the first thing that we should do is assess. And so we want to check the patient's blood sugar and fall risk before we jump to intervening. Let's take all of our information and figure things out first, and then we can act. Okay, let's look at a Parkinson's medicine now. Levodopa-carbidopa therapy requires monitoring for which long-term complication? So is it dyskinesia, which is those involuntary movements? Is it hypotension, low blood pressure? Is it hyperglycemia, which is high blood glucose? Or is it seizures? So we're talking about Parkinson's and a long-term complication of levodopa. So hypotension can happen in the beginning, but not long-term. Blood sugar should not be affected at all taking this medicine. So B and C we can kind of eliminate. Seizures, no, this isn't really a complication of this medicine either. So by process of elimination, we're going to go with dyskinesia, and hopefully we know that this can happen when they have too much dopamine, and that's what this medicine does. So long-term treatment with levodopa can cause dyskinesia, which is those involuntary erratic movements, usually in the face, arm, legs, or trunk. And this is the medication kind of wearing off because it probably needs to be increased. So the answer is A. Okay, so we have a patient on a dopamine agonist, and they're reporting that they're suddenly falling asleep. So that's narcolepsy. So what is your priority? What is the most important thing if a patient is having narcolepsy? Do we want to encourage daytime naps, or do we want to notify the doctor and assess our safety risks? Do we want to increase the medicine, or do we want to recommend caffeine? Okay, so let's break these down. So A, encouraging naps. Okay, that makes it worse. That actually makes it worse. It does not help anything. Notify the doctor and assess safety risks. Assess, ding, ding, ding. Those are usually important. And we definitely want to notify the doctor if they're having narcolepsy. So safety is very important, and then assessment is important, safety is important, and we need to notify the doctor. So that's our answer. But let's look at the other ones too, because we never want to pick and be sure of an answer until we've read all of our options. Increase the medication dose, that's only going to make it worse. That's not going to help. And recommend caffeine intake. Okay, so yeah, maybe that's going to help them stay awake a little bit more, but that's not addressing the main problem of this patient's dopamine agonist is giving them narcolepsy. So it can cause narcolepsy without warning. So we're concerned with safety, like with falling asleep while driving. We need to let the doctor know. Answer is B. Okay, so let's look at our antibiotics or anti-infectives. So which antibiotic requires monitoring of peak and trough? So first off, you need to understand what is a peak and a trough. And so a peak is what is the medication's highest level in the blood when it is working its most effective. And the trough is what is its lowest. So we know that this antibiotic could cause toxicity, and we need to have labs drawn to see the level in the blood. That's what the question is asking. So is that amoxicillin? We don't really check labs with amoxicillin or worry about toxicity. I'm just going to eliminate that. Is it Cipro? Ciprofloxacin or it's a fluoroquinolone. We don't really monitor for Cipro. Azithromycin is a common Z-Pack that we get all the time. It's a macrolide. We don't really monitor. Vancomycin is a narrow therapeutic index, and we have to monitor. This is given IV to patients. They have to be inpatient at the hospital, and it needs regular peak and trough lab work drawn to make sure it's in a therapeutic range and that it's not being toxic. So if you know vancomycin, it is known to cause ototoxicity, which is problems with the ears and deafness, ringing in the ears, and nephrotoxicity, which means it's harmful to the kidneys. And so we have to make sure that it is not getting too high in the blood or causing toxicity. So the answer is B. A patient receiving Cipro reports tendon pain. What do you do? Okay, Cipro, tendon pain. What am I going to do? Okay, so we're going to tell them to stop taking the medication and report. Okay? Or we're going to suggest warm compresses. Okay, so tendon pain is a serious complication of Cipro. So warm compress is not going to do anything for that. We should encourage fluid intake. Well, but the tendon pain is usually from tendon damage. So increasing fluids is not going to do anything. If it's a muscle cramp and they're dehydrated, sure. But we already know that Cipro can cause permanent tendon damage. So we're just going to document and continue, which means that we're not going to do anything. Doing nothing is not a good option. So the answer is A. We're going to have them stop taking it and report it to the doctor. No, we don't typically tell the patient to stop taking it. But since we know Cipro is a fluoroquinolone, and it has a black box warning that it can cause tendons to rupture, especially the Achilles tendon. And a sign of tendon rupture is tendon pain. Okay, and so this is immediate interaction, and let's stop the medicine, notify doctor, and send them to an ortho. So the answer is A. Okay, so when we're looking at taking our HESI, these are NCLEX questions, which are the same as HESI questions. So success with a HESI or an NCLEX for pharmacology, make sure that you know the drug classes and how they work, the mechanism of action. How does it work in the body? Monitor labs and patient responses. Make sure you know what are you supposed to monitor for every drug class. Prioritize patient safety. So if it causes falls or anything else about patient safety, make sure you intervene. Make sure that you educate patients and you know what to educate on the specific medicines and when they should call a doctor. What is a typical side effect that they should expect versus when do I call the doctor? This is bad. And also always use your clinical judgment. Dose cal, prioritizing, evidence-based decisions makes you a good nurse. And all of this is encompassed in HESI and NCLEX. I hope you do well on your test.